years since a discredited link between the MMR jab and autism led to a fall in the number of people having the vaccination.
In a moment, we're going to speak to a consultant from Public Health England. But first, here's our health correspondent, Matthew Hill.
Glastonbury this summer saw a significant rise in measles as young people from across the country mingled, and so too their bugs. And the latest figures from Public Health England suggest there's been an increase in measles across the UK. Experts believe that's partly down to this former Bath researcher, Dr. Andrew Wakefield. It was 18 years ago when his controversial study appeared in The Lancet, suggesting a possible link between MMR and autism and bowel disease. The paper was soon discredited, but the damage had been done and thousands of parents refused to get their children inoculated. Now those unprotected 18-year-olds are about to go to university. And one doctor from Bristol says she's dealt with patients who've contracted the illnesses because they were not protected.
So I have seen over the years since measles, but more than I would have expected, and measles is a very unpleasant illness that can kill. I've also seen more mumps and rubella than perhaps one would have expected. Rubella particularly has a risk to the unborn baby, so if you're a mum who's never been vaccinated, you get it in pregnancy, your baby will have problems.
There's a killer which takes a baby's life nearly every day. Don't let diphtheria attack your baby.
The childhood immunisation programme introduced just after the war has been highly successful. Doctors are also keen to get their message across to teenagers who've missed out on the new meningitis ACWY vaccine in the hope that more lives can be saved. Matthew Hill, BBC Points West, Bristol.
Well, Dr. Bharat Pankania is a consultant in communicable disease control with Public Health England in the southwest. Thank you very much for coming in to talk to us today. So first of all, to put some perspective on this, how big is this problem?
Well, measles is very infectious, and if you have unimmunized or underimmunized people and there is a measles virus circulating, they will get infected because it is really infectious. It's one of the most infectious viruses around, and the control for it is ever so easy. You have your MMR jabs. Two jabs will give you about 99% protection from this pretty serious illness. Measles can make you miserably ill, and it's best to be protected by two vaccines.
So, in your opinion, this scare has left quite a damaging legacy, really.
We have been battling with what happened following that paper 18 years ago for so many years, and I feel finally we're getting there in that people are now less worried about the link between MMR and harm that they thought they might have been. And I would urge that you can have your MMR vaccine at any age. If you've missed your childhood vaccines and you're about to go to university or further education college, go to your GP and update your vaccine. If you think you have had the vaccine and you're not sure and there is uncertainty and you end up having a third jab, it's not going to do you any harm at all. Therefore, I feel it's a no-brainer to be fully up to date with all your vaccinations, the meningitis ACWY strain, as well as the MMR vaccination.
I was going to say that actually because of course it's been in the press today also about meningitis, so I guess all these students are feeling that they're being injected like they're going on a year out, not just a year to university.
Well, it's good to be protected. They're about to start on their university career and all nice things, going to make new friends, new places, and why not come healthy and stay healthy? And it's ever so easy because you are protected and then you remain healthy, you don't get infections, and is the easiest thing you could do.
Brilliant. Well, Dr. Pankania, thank you so much for coming in to chat to us. So measles and meningitis to the students at home.
Thank you.
Thank you.